and I'm from Manhattan, Kansas, with Kansas Regenerative Medicine Center. We started in March of 2014. One of the first patients we did was my wife. She had had her right knee replaced, and her left was in need of replacement. She didn't want to go through that again, although it had worked well and was functioning properly. And it was about 3 or 4 weeks later, she was surprised to tell me that she wasn't needing ibuprofen anymore. And that's continued for the past, 15 months, something like that. We live in a 2-story house. She's active. We raise cattle. She's outside with cattle and grandkids and things like that. She's now undergoing cardiac rehab. She had a stent in one of her coronaries and is really doing well. But in 12 weeks of rehab, 3 mornings a week for an hour and a half on the treadmill and the bicycle, she's able to do it and feels very good. So I've been very pleased. This clinic was started by...
You can look at me too.
Can I too?
Yeah,
But some, but not...
Look in here. You can look
Okay.
Yeah.
Some, okay. Anyway, our clinic was started by a couple fellas who had come out here to California and had joints injected. One fella had his shoulder and elbow injected, and the other had his knee injected from old sports injuries, and they got better within a few months, were able to play golf as they wanted and walk with free of pain, and decided that perhaps we should start a clinic there in Manhattan. They contacted me, and I had retired from about 40 years of diagnostic radiology, and I'd been retired for about 1.5 years, and I was intrigued. I said, you'll have to convince me, because like a lot of MDs, don't know much about stem cells, and wanted to be careful what I was getting involved in. They brought a lecturer to town, someone I could talk to and listen to with vast experience in stem cells. I came out here last year to the conference. I was encouraged by the things I heard and felt that it was a worthwhile endeavor. We've done mostly arthritic joints. We've had very good response treating people with arthritic joints, much like my wife. We're averaging probably 4 to 6 patients a week. That's all we do is stem cells. We inject also PRP with the stem cells, but that's our clinic, regenerative medicine. We have treated other disease entities. We've got, one patient comes to mind, a lady in her 40s with fibromyalgia, and she has felt much better from right after the injections. Her pain had gone down. She's able to move around better. Her overall attitude has improved. It has worked very well. We've had several people with diabetic neuropathy. One who she doesn't have diagnosed diabetes, but her body type and her age suggests that she might be diabetic. She's had neuropathy for several years and happens to be a neighbor of mine, and she feels much better. Another fellow in town, diabetic with bad neuropathy, and he's been happy to talk to other patients about his injections and how it helped him. We've treated some people with stroke. We had a fellow in his early 60s who had a radiation-induced injury to the motor strip 17 years previously. And we treated him with intravenous stem cells, proceeded with mannitol, and he had improvement. He's not running marathons, but he's able to walk better. He's got improved sensation in his leg, and now can walk with 1 cane, not 2, and he's very pleased with that improvement. I've been very pleased to be associated with Cell Surgical Network. I think this is the premier group to be working with. The technique is right, the process is right. They've been very supportive. Anytime I have a question, a patient asks me something that I can't answer, I send an email, and usually by the next morning I have a reply from Dr. C, from Dr. Berman, from Dr. Landers. And that sort of thing has been very helpful to make things grow. I think there's a large future in stem cells, and I don't think I can really imagine where it's going to go. But we get calls all the time from people with different disease entities, and we're willing to try some of the new things. I'm especially interested in learning more about the neurological diseases and how that has gone, and intrathecal injections. Has that helped with improvement in neurological diseases? I think the future looks bright.